Hi everybody. I got asked a few times in the last couple weeks what spondylolisthesis is because it showed up on the news. They want to know what it is, why does it hurt, can I get it, and all of that. So I figured it would be better just to show you than to explain it with words. Pictures are great, images are great. So what spondylolisthesis means is spine slippage. So there's a slippage of one vertebra over another. So I'm just going to show you what normal looks like. This is my handy dandy spinal degeneration model. Okay, so even if it's not degenerative, you don't need degeneration to have this, although they usually go hand in hand. Here's a spinal segment. This is low back. Okay, so it's close to what we've been talking about. So this is a vertebra sitting on another vertebra. Okay, these are the bodies of the vertebrae. And this here, this is the disc. Okay, what that looks like is a little gel pad with concentric circles of fibers at 45-degree angles. It's actually really nicely designed. So there's fibers going this way, fibers going this way, fibers going this way, fibers going this way, okay, and so on. And that makes it real strong. Okay, so that's what a disc looks like on the inside with a little gel pad, kind of like a toothpaste texture. All right, and then the healthier and fatter these discs are, the more space there is between the vertebrae. So this here, this is the nerve coming out. So your spinal cord goes through here, and then at every set of segments, one on top of the other, there's a pair of nerves that comes out and innervates everything in the body. Whatever your body does, this is controlling it, okay? So nerves control all of it. So if this is in low back, this would be going toward lower abdomen and lower limbs, okay? So that's what the spine looks like normally. So when you hear spondylolisthesis, whoops, sorry, what's slipping is one vertebra over the other. This can happen for several reasons. Sometimes these little pieces here can fracture and it slips. Sometimes it's degeneration over time. Sometimes it's an anatomical variant that wasn't shaped right. Sometimes there's a trauma of the disc, and now the disc is lower and flatter and loses integrity. And because it's lost integrity, this will slip on this. So you can have retrolisthesis where it slips backwards. You can have anterolisthesis where it slips forwards. If you've seen x-rays recently in the news of somebody's spine after surgery to correct this, that slippage is still visible in that, even with the pins right on top. So why does that matter? So this right here, this ring of bone, FYI, what chiropractors are doing and working on, we can help disc in the way of taking pressure off it. But when you're hearing those clicks and pops during an adjustment, it's these guys here, these joints. There's a pair of joints. Hello. So there's two on the bottom, two on the top for those. In the rib area, there are 6 joints per vertebra. In all the others, it's 4 joints per vertebra. It's a lot of joints. So where chiropractors are working, chiropractors. I sound like Christopher Walken. Chiropractors. I don't know. Edit. Okay. So this is where we get motion in here. Okay. Where the spinal cord goes through, though, that's a bone ring. You can't get motion in a bony ring. So this can be a problem when there's stenosis, is when this ring of bone, when this space for the spinal cord gets thinner and there's less space for it. That can happen for a variety of reasons. It could be a disc bulge. It could be a joint tissue pushing into that space. It could be a ligament that didn't belong there. And it can be the ligaments that are inside this space with it can get swollen. That can happen. And another thing that can happen is spondylolisthesis, where if it slips. So because that's a ring, let's say you have, a ring of bone and the spinal cord's going through that. And then you have stacked vertebrae on top of each other. So as long as that space is clear of anything else, the spinal cord's happy and it can do its job. But if you slip one vertebra over another, back or forwards, do you see how now that nice big space for your spinal cord is diminished? I'm trying to make here, I'll put it in front of my hair because it's dark. Okay, so not enough room, not enough room. That can cause a lot of pain. It can also cause other issues. It can cause cauda equina syndrome. It can cause problems. So when you have that slippage, that's really an issue with function and comfort. So to have a surgery that doesn't work for that, and now you have the surgery to work through as well, it can be a lot. So when someone has spondylolisthesis, there's different grades of it. Some of it's so mild they didn't even know they had it. Some of it is severe like that. So I hope that answers your question. What is spondylolisthesis? Whether you think you know someone who has it or you wonder about that, the only way to find out if that's something that's going on with you or someone that you know is to do an exam and imaging to see what's going on in that area. And then we, can take a look at knowing what's wrong is the first step to doing something about it. So I hope that answers your questions. If you have any other questions, you can give me a ring at Well Adjusted, and actually keep asking questions. I kind of like going over this nerd stuff. All right, I'll talk to you guys soon. Bye. Have a great week.